Madam Chair, and thank you to both our witnesses for coming here today. Dr. Gutiw, I recently visited Amy in Edmonton, and the presentation was done that we moved from researcher to learn about their individual initiative. I was somewhat struck that there doesn't seem to be any coordination amongst the various researchers in terms of bigger questions that needed to be answered that perhaps were priorities for Canada. Just as an example, there was a demonstration of an ultrasound wand that could be used in remote communities, not by physicians necessarily, but by nurses, allied health professionals, avoiding potentially transfer to a southern medical center, and therefore saving, obviously, some money. How do you see, what is the coordination that's going on across Canada between all these individual researchers, and how do you see that best being brought together? What role could the federal government play in that?
Thank you for your question. Curiosity-based research remains a critical area. I believe that organizations like Amy, Mila, the Vector Institute, and others foster the ability to bring these new innovations, and we need to have that curiosity-based research. Where we seem to have a gap is taking that individual research and then progressing it to tangible, practical. And that example you have is an excellent example of how there is a need and a problem that can be solved with research. As we continue to incubate these solutions that come from research, we need to focus on what's the problem we're trying to solve. How can we then bring the best of the industry thought leaders across Canada from the data infrastructure, from the AI compute capacity, as well as creating tangible solutions that have a benefit to society as well as are marketable. By bringing together clusters of industry thought leaders to be able to move these along, streamlining a lot of our great funding programs that are hard to access, hard to understand, are unclear to researchers, to startups, and streamlining, having a single pane of glass view to how can I take this idea quickly while it is still an innovation and move it to something that's a tangible benefit. I believe by having groups of sectors together, health, social sciences, manufacturing, robotics, oil and gas, energy, critical minerals, we'd be able to bring thought leaders across a spectrum that can take these curiosity-based research and move them forward, progress them into something that will benefit us in society as well as a revenue-generating marketable solution.
As a physician, I know that you have particular expertise in the medical information sector. Could you just detail for us some of the most promising applications that you see for the use of AI to assist the medical and health professionals?
Thank you for your question. Health has been leveraging machine learning, AI, and data for decades, my entire career. Everything from public health solutions, looking at how we can use data, not just to inform what may happen in the future in disease progression, in addiction, in opioid crisis, but being able to look at the data to see how can we get ahead of that? How can I make a change early in a cycle of addiction or homelessness so that somebody can have a better life and we can target the problem and be able to provide a solution sooner. Other areas where we really have moved the dial with artificial intelligence would be in diagnostic imaging. You know, artificial intelligence is a fantastic tool to see things that are very hard to see with the human eye. We're already working with Helsinki University Hospital and others on being able to detect early brain bleeds that are almost always fatal if not caught early. Being able to reduce the screening ages for cancers because we can see minute changes earlier. And as I mentioned, things like digital triplets where I can have a conversation with a large amount of data that's very hard, complex, expensive to be able to pull together. I now have the ability to be able to bring that information together with agentic AI, multi-model AI, and have a conversation with data to make better decisions and connect the dots and patterns.
How much time do I have?
1 minute, 20 seconds.
Okay. Again, Dr. Gutiw, to you. You mentioned public trust. Recent reports have said that CRA, as an example, obviously a federal responsibility, that a number of the pieces of advice that have been given have actually been incorrect through the current system of call centers and so on. And CRA is looking to introduce AI. Isn't there a bit of a problem of garbage in ending up as garbage out in the introduction of AI? And how would you see the best way of avoiding that issue?
You know, the advancements in research and where we've been focused on is increasing the reliability. So by taking the AI tools you see now and rather as a search engine, use it as a service, how can we focus it on knowledge retention, getting access to information very quickly, and using agentic models to test the quality of the answers before they're received? We're at a perfect time in our history where we have 25–40% of the population will be retiring in the next 10 years. These tools are a fantastic way of maintaining that knowledge and being able to serve us in service delivery so that the call center people will have access to all of that knowledge that is retiring and be able to get very quick answers to questions. But you're absolutely right. More research, more investment into quality solutions, reliability, transparency is going to help solve that over time so it becomes more reliable.